Welcome back. I'm here again with Laurie Bodenheimer, Associate Director of Healthcare and Insurance at the Office of Personnel Management. Laurie, before the break, we were focusing more generally on open season and the FEHB program, a little bit about FedVIP, a little bit about SA Feds too, lots of Fs there. Definitely some important updates that participants should be aware of. But I do want to pivot now to talk about the new Postal Service Health Benefits Program, or PSHB, what's coming and what participants should expect this open season. This is, of course, it's the inaugural year that postal employees and retirees will be participating in PSHB through open season. So just off the top, what would be the most important information that postal participants should know as they are heading into open season?
So thank you, Drew. The Postal Service Reform Act was signed into law in April of 2022. And right after that, we began active implementation activity. So this has been, 2.5 years in the making, working very closely with a number of stakeholders, no one more so than the United States Postal Service, on this implementation. And we're very excited about how far we've come and what we hope to offer postal enrollees as we move forward. We know this is a big change for them, and we are working hard to make it as seamless as possible, and to offer, very comprehensive customer support as we go through this transition. So a couple of things. First of all, the plan year will be a little bit different under postal than it is in the FEHB program. All coverage, whether you're an active employee or an annuitant, will begin January 1 and run through December 31, a calendar year, which is, sort of easier and for people to remember and sort of normal, in my opinion. So, that is one important change. The other is that we've worked very hard to have a good number of carriers offering plans that are just as comprehensive as what they are comfortable, what they've been accustomed to under the FEHB program. So there will be 30 PSHB plans. In this first year of the program, the benefits and the cost sharing are identical to what is on the FEHB side. The premiums are slightly different, and we can talk about that. But the one significant difference is there's more integration with Medicare, particularly Medicare Part B. And Medicare Part D in the postal program versus the FEHB program. So I'd like to just talk about that for a minute. You may know this year we offered a special enrollment period for current postal annuitants who were not yet enrolled in Medicare Part B. So if you don't enroll in Medicare Part B when you're first eligible to do so, there is a late enrollment penalty that the Medicare program imposes, and that never goes away, and it is 10% per year that you could have been enrolled and did not enroll. So over time, that can become, a not insignificant added expense for people. So through this special enrollment period, I believe it's almost 40,000 people chose to enroll. The Postal Service will be paying that late enrollment penalty. So if you took advantage of that special enrollment period, you would pay the regular Medicare Part B premium, but without any late enrollment penalty associated. So that was a big effort, and that we did cooperatively with the Social Security Administration and the Postal Service to, notify all those enrollees, answer their questions, send them some reminders, and we're quite pleased with the outcome of that program. The second thing is that under the Postal Service Reform Act, every PSHB plan must offer and integrate a Medicare Part D EGWP into its benefits. And so if you are a Part D eligible annuitant, and remember, we know some of our annuitants are younger than age 65, so this is only referring to those who are 65 and over and eligible for Part D, will be automatically enrolled in that plan's Part D employer group waiver plan. If you opt out, and we strongly encourage you to ask a lot of questions and make sure that's the right decision for you. If you do opt out of that Part D coverage, you will not have prescription drug coverage under your PSHB plan. There are undoubtedly a very few people for whom that is the right choice. For example, you might already be enrolled in a Part D plan through a spouse or some other coverage. You can't be enrolled in two Part D plans. You may, because of you're lucky enough to have a high enough income, be subject to some of the income penalties that are that the Medicare program has. But again, this is going to be for very, very few individuals, and we encourage you to contact your plan and discuss it with them to see whether you're in that group, or to see if they can answer any concerns or questions that you have. So, the Medicare Part D EGWP is probably the most significant change between the Postal Service Health Benefits Program and the FEHB program. Now, what many folks will be seeing, though, is that in this first year, the postal premiums have often been less. The overall premium has been less than that in the FEHB program. There may be a couple of situations where the enrollee share is not less. Again, this is part of why you do the shopping. There is a new decision support tool that is available in the Postal Service Health Benefits Program. You can shop anonymously if you're not yet comfortable setting up an account, meaning you don't have to identify yourself and set up that account in order to do some browsing and see compare plans by premium or by whether your doctor or doctors are in network in those plans. It's a greatly enhanced tool, and we hope that you take advantage of that. Those are the most significant. The DST will also provide more detailed benefit information than what is currently available on the FEHB side. So we're looking forward to getting some feedback from enrollees on how they have used this decision support tool and whether they found it helpful.
Thank you so much, Laurie. I think there's a lot of really important information there that is going to be super important this open season for postal employees as well as annuitants and their family members all to know. I did want to ask just a couple follow-up questions about specifically the Medicare Part D and prescription drug coverage. And how that's going to work for the postal program. So you mentioned that it is, that's a difference, that's a major difference between PSHB and FEHB. Can you just explain the reasoning behind why it's different between the two programs?
It's mostly as a result of the legislation. Congress passed the Postal Service Reform Act, and so in our development of the program, we had to follow the mandates under that act. I mean, we've issued several regulations to explain some of the decisions that we've made and how those will be implemented. The first one came out more than a year ago, and the final rule, the second final rule, just came out and was published last week, and those are fully available on the Federal Register, easily found via Google, and we will continue to put out more guidance to carriers and to the agencies that are most impacted, which is the Postal Service, OPM Retirement Services, actually the Department of Labor's Office of Workers Compensation Programs, and the National Finance Center, who will be doing the customer service for both employees and annuitants to make sure that everyone is fully aware of their obligations and how this program will operate.
Thank you. And also, I would expect that there may be some confusion on part of the postal annuitants who are going to have to be looking at the Medicare options. So is there anything, for example, if they make a mistake during open season by opting out and they didn't mean to, is there any way to kind of correct that later on?
So we obviously had to work very closely with Medicare, with CMS, on these aspects because Part D is their program. We have done so, and the final rule, sort of recognizes that as a new program, there are always implementation bumps in the road, if you will. I mean, sometimes we make mistakes. Sometimes an enrollee, makes a decision based on bad information or not understanding, and we wanted to try to ameliorate that to the greatest extent possible. So there is a grace period, in the event of an error, whether it's an enrollee error or an error by a carrier or an error in information that might have been given out by OPM as part of its customer service. In all cases, the enrollee needs to contact their plan and say, this happened to me. I think it was an error, or I opted out in error, and I would like to undo that. And we're working with the carriers on how to help enrollees in those situations.
And is that something that will be open just for this inaugural open season? Is that something that OPM would consider continuing throughout the first couple of years of the postal program?
There's no set timeline, obviously. So it's sort of a let's see how it goes. Let's see what we experience this open season, and we'll take it from there and make a good decision. But we have the flexibility to go beyond this first year if the situation we think warrants that.
And then, of course, just kind of hoping that not many people will be making errors. There is, of course, the possibility for that. But before that happens, or just to try to kind of prevent against that, are there, different places that postal enrollees can call, any customer service options they can speak to kind of get answers to their questions, whether it's about Medicare or anything else that's coming for PSHB this year?
Yes, we've also put up a separate page on our website specific to the Postal Service Health Benefits Program. There's a lot of information out there already, and we will continue to add more as we get closer to open season and as we see the need to try to be responsive to questions that are coming in. So I'd encourage folks to go to our website and look for that postal site. The Postal Service is also offering has been offering webinars fairly consistently since the springtime, and is quite engaged in the open season in helping their people understand open season in general. So they're actively engaged. They have resources. What I neglected to mention earlier is to try to make this transition a bit easier is we are what's called auto enrolling every single postal person who is enrolled in an FEHB plan into a comparable postal plan. And those letters have begun to be mailed. I don't think any have been received yet. But we would expect by next week that people will begin to receive that correspondence. So it tells individuals, here's your current FEHB plan, and here's your comparable postal plan that you will be auto-enrolled in. Every single person has the opportunity to change that enrollment if they want. If they do nothing, that is the plan they will be enrolled in. Our overriding goal in implementing this program is to make sure everybody who had coverage continues to have coverage. So we can feel comfortable that they are enrolled in a plan. More than 90% of current postal FEHB enrollees will be enrolled in an entirely comparable postal plan. About 10%, not every FEHB plan chose to apply to become a postal carrier. And so we have some criteria for that remaining 8 to 10% of individuals, how they have been auto-enrolled. But again, you get your letter. It tells you which plan you will be enrolled in. It tells you who your covered family members are, and it tells you how to go into the portal, our new enrollment portal, and make any changes in your family members or in your choice of a health plan that you want. And we encourage people to do that shopping.
And then just to clarify there, the 10%, little less than 10%, who don't have a comparable plan option, what happens to them? What are they going to be automatically enrolled in?
So some of our FEHB plans have three options. I'll use the Blue Cross and Blue Shield Service Benefit Plan as an example. There's the standard option, there's basic option, and there's Blue Focus. In that case, they have chosen to offer all three of those options in postal, but there may be another carrier that had 2 or 3 options and have chosen not to offer one of those options in the postal program. But they still will be a postal carrier. If that's the case, and you were in that option that is not moving over, you will still be in your plan, but will choose the option that most closely fits. If your plan did not choose to apply at all and become a postal carrier, we do what we do in the FEHB program, which is you are enrolled in the lowest cost nationwide plan that does not have a high deductible health plan in terms of what your enrollment will be. And again, you can change that if you so desire.
And if people are looking to change that, as you mentioned during open season, I believe you said this in the first half of our conversation, that there is a different plan comparison tool for the Postal Service. Can you talk about how that's going to look and where participants can access that?
So that is accessed again through OPM. There's a link to the postal page, and that's where you can access the new Postal Service Health Benefits System, which is the enrollment portal. And again, that's where you can access the decision support tool, set up your account, make open season changes, your qualifying life events after the open season period ends. Will also be done through this new central enrollment portal, which is PSHB system. And so that decision support tool, as I mentioned earlier, you can shop anonymously, or once you're in your account, you can also access it through there. And it goes through a series of questions, trying to gather information to help show you what plans you might look at. So obviously where you're located, and how many family members you have, and what's more important to you. Is it a lower premium or is it lower cost sharing? So it has some algorithms built in, and it can show you 3 separate plans at a time. You can go back and do it again, but so research has shown that to have too many open is not helpful to people. That they, to really do that comparison, you need to sort of limit how many at one time. But of importance, we know how important it is for people to people are, once you've chosen a doctor and you like that physician, you like to stay with that doctor. And so that's one huge outcome that you can check and see across 3 plans. Is my physician in these 3 networks or not? Because that would help you make a decision. Again, based on your preference, do I want lower premium to be shown as the primary filter, if you will, or more sort of the overall cost of care? It's trying to get to that level of detail which we've been encouraging people for some time, is look at the total cost of care, not just the premium, and not just your out-of-pocket expense for any particular service.
So, Laurie, also there might be some differences, for example, with flexible spending accounts, vision and dental care. What does that whole landscape look like for postal enrollees? Are there any differences between PSHB and FEHB there?
With respect to FedVIP, no. Postal employees and annuitants remain fully eligible for FedVIP coverage, and they would continue to enroll or change their enrollment for those benefits through benefits.gov. The Postal Service has chosen to offer its own flexible spending account program for 2025. They are in the process of notifying their active employees about that change and how to go about enrolling. So they will not be participating in FSA Feds as of January 1, 2025.
But there will be options separate for them to look at potentially having an FSA.
Again, the Postal Service will offer its own flexible spending account program. Yes.
Thank you. And just one other question, touching back to something that you mentioned very early on in this half of the conversation, talking about the premiums for postal enrollees. You mentioned it's a little bit different from FEHB. Just can you talk about how those premiums are calculated and what any differences might be there?
So the premiums are calculated the same way. Remember, the Postal Service Health Benefits Program is separate, but it is within the FEHB program. So unless we specifically called out something different in the postal regulations, FEHB regulations still apply, and that includes who's eligible to enroll and how premiums are set. It is the same formula. It's just applied now to the postal population only, separate from the FEHB population. So that explains, plus the anticipated expenses or savings, if you will, from the Medicare integration that account for what we're seeing in terms of lower premiums for postal enrollees versus FEHB for going into 2025.
Thank you. And just wrapping up here, Laurie, is there anything else that postal enrollees need to know, or one final message that you want to leave them with as we enter open season this year?
So again, we recognize, any new program can be challenging to implement, but this change, we in particular have spent quite a bit of time on our customer support ecosystem. We are working with several different customer support organizations, but are trying our best to make sure it's a seamless experience for customers. So for example, if I'm an annuitant and I call the Postal Service, they'll be able to automatically transfer me to retirement services to access the right folks who can help me with my enrollment. We'll be having frequent touch bases and ongoing. This will be a very different open season for all of us in terms of trying to make sure that our customers are well supported, well cared for, and that their questions are answered as we move into this January 1 implementation date.
Well, Laurie, I really appreciate your time today. I'm sure our audience does as well, just to hear more about how all of this is going to look this open season. But in the meantime, thank you so much, and we'll all be looking out for how open season will work this year.
Thank you, Drew. Very much appreciate the opportunity to talk with you.
And again, Laurie Bodenheimer is Associate Director of Healthcare and Insurance at the Office of Personnel Management. I'm Drew Friedman, and you're watching Federal News Network. I'm sending you back to the studio now for more on our open season exchange.